Arthroscopy has become an increasingly popular surgical technique, favored for its minimally invasive approach and quicker recovery times compared to traditional open surgery. Surgeons and patients alike appreciate the smaller incisions, reduced scarring, and faster return to daily activities. However, despite these advantages, arthroscopy is not entirely free from complications. Among the most concerning are nerve lesions, which can have significant impacts on patient outcomes and satisfaction. Understanding the risks and mechanisms behind these injuries is crucial for both surgeons and patients as the number of arthroscopic procedures continues to rise worldwide. Nerve lesions during arthroscopic procedures can be particularly devastating. For patients, these injuries may result in anything from temporary numbness to permanent paralysis, affecting quality of life and daily function. For surgeons, nerve injuries are frustrating complications that carry not only medical, but also psychological, economic, and even legal consequences. This dual impact makes the prevention and management of nerve lesions a top priority in orthopedic surgery. Recognizing the seriousness of these complications helps drive ongoing research and improvements in surgical technique. Nerve injuries during arthroscopy can happen in several ways. Direct damage may occur when nerves are accidentally cut while creating portals or during surgical maneuvers. Indirect injuries often result from traction or pressure, especially if the patient is not positioned correctly. Even the use of a tourniquet can cause compression and ischemic injury to nerves. These mechanisms highlight the importance of careful surgical planning and execution, as well as the need for vigilance throughout the entire perioperative period. Nerve injuries are classified according to Seddon's system into three main categories: neuropraxia, actinic and neurotmesis. Neuropraxia is a temporary block of nerve conduction, often resolving within weeks to months. Actinic involves damage to the axon but leaves the connective tissue intact, allowing for potential recovery over time. Neurotmesis is the most severe, with complete disruption of the nerve structure, often resulting in permanent loss of function unless surgically repaired. Understanding these types helps guide treatment and prognosis. Overall risk of nerve injury during any surgery is relatively low, estimated at 0.1 to 0.2%. However, arthroscopic procedures across different joints show varying rates of nerve complications. Factors such as joint type, surgical technique, and patient positioning all influence the likelihood of nerve injury. While these numbers may seem small, the consequences for affected patients can be significant, making even rare complications worthy of attention and preventive efforts. Arthroscopy is one of the most common orthopedic procedures, especially for meniscectomy. Despite its popularity and generally low complication rates, nerve injuries can still occur. The saphenous and common peroneal nerves are most frequently affected, with reported nerve lesion rates ranging from 0.01% to 0.06%. Most injuries are neuropraxic and resolve over time, but more severe cases involving the femoral, tibial, or sciatic nerves have been documented. Proper portal placement and careful handling of instruments are essential to minimize these risks. Older arthroscopy offers many benefits, such as smaller incisions and faster recovery. However, it carries its own set of nerve injury risks. The most commonly affected nerves include the hypoglossal, brachial plexus, axillary, and suprascapular nerves. Complication rates for nerve injuries range from 0.2% to 3%. Most are temporary neuropraxias, but direct injuries can occur, especially with improper patient positioning or excessive traction. Surgeons must pay close attention to both technique and patient setup to reduce these risks. Wrist arthroscopy is generally considered safe, but it requires a significant learning curve for surgeons. Complications are rare, but nerve injuries, especially to the sensory branches of the ulnar and radial nerves, can occur. Reported rates of nerve injury range from 1.17% to 1.5%. Most injuries are minor, but major complications can lead to lasting sensory deficits. Proper training, careful technique, and awareness of anatomical landmarks are essential to minimize risks during these procedures. Ankle arthroscopy has expanded rapidly in recent years, offering new treatment options for joint disorders. However, the procedure carries a relatively high risk of nerve injury, particularly to the superficial peroneal nerve. Complication rates for nerve lesions range from 1.9% to 5.8%. Prolonged or improper positioning can also lead to compression injuries, sometimes resulting in permanent deficits. Surgeons must be vigilant about limb positioning and portal placement to prevent these complications. Elbow arthroscopy is a technically demanding procedure due to the proximity of several major nerves. The ulnar, median, and radial nerves are at risk, with reported nerve injury rates between 1.7% and 2.5%. Most injuries are minor and resolve over time, but major complications can lead to permanent deficits. Careful portal placement, anatomical knowledge, and gentle handling of tissues are critical to minimizing nerve injury risk during elbow arthroscopy. Hip arthroscopy is a relatively new procedure, often performed on younger patients with less advanced osteoarthritis. The complication rate for nerve injuries is higher in hip arthroscopy compared to more established procedures, ranging from 2% to 6%. Nerves at risk include the pudendal, common peroneal, gluteus, femoral, and lateral femorocutaneous nerves. Traction and prolonged procedures increase the risk of compression injuries, making careful planning and monitoring essential. Nerve injuries during arthroscopy can be classified as direct or indirect. Direct injuries occur when nerves are cut or damaged by surgical instruments, often during portal creation or tissue manipulation. Indirect injuries result from traction, compression, or ischemia, frequently related to patient positioning or tourniquet use. Both types of injuries can be minimized through meticulous surgical technique, proper patient positioning, and continuous intraoperative vigilance. Preventing nerve injuries in arthroscopy relies on a combination of surgical expertise, anatomical knowledge, and strict adherence to safety protocols. Key strategies include careful patient positioning, minimizing traction and tourniquet time, and using protective materials when necessary. Surgeons must also be aware of the specific nerves at risk for each joint and adjust their techniques accordingly. Ongoing education and experience play a vital role in reducing complication rate. Nerve injuries do occur. Timely and appropriate management is crucial. The recommended approach is to wait 6 months before considering surgical nerve revision, allowing time for potential spontaneous recovery. During this period, patients should engage in regular physiotherapy and undergo clinical and electromyographic evaluations at set intervals. Early detection of improvement or persistent deficits helps guide further treatment decisions and optimize outcome. Arthroscopy offers significant benefits but is not without risks, especially regarding nerve injuries. The incidence of these complications varies by joint and is influenced by surgical technique, experience, and patient factors. Prevention remains the best strategy, emphasizing the importance of education, careful planning, and adherence to safety protocols. As arthroscopic techniques continue to evolve, ongoing research and training will be essential to further reduce the risk of nerve lesions and improve patient outcomes.